Well, welcome to Compuware's World Headquarters for what we believe is a wonderful announcement. I'm Bob Kennedy, Vice President of Strategic Services and a member of the Hospice of Michigan Foundation Board. Hospice of Michigan touches so many people in the work that they do. When a patient receives care, Hospice of Michigan impacts the lives of patients, family members, friends, and the community. That connection at times, however, is hindered by distance. For friends and family who live perhaps out of state or even out of country, it's difficult at times to get timely information about how their loved ones are being cared for. 2 years ago, Compuware and Hospice of Michigan began discussions on how we could extend their great work to family members who are not nearby and create a connection rather than simply sharing information about hospice work. Today we are celebrating the launch of Phase 1 of that vision by deploying a mobile application for Android and iPhone devices. This application lays the groundwork for family members to gain not only a deeper understanding and awareness of Hospice of Michigan and the great work that they do, but also creates a very personal connection through an understanding of the care that family members are receiving and who's providing that care, regardless of where they reside. So with that, I'd like to introduce Dottie Daramo, President and CEO of Hospice of Michigan.
Thank you, Bob. And thank you all for being here. Thank you especially to you and your Compuware team for all the development work, and on behalf of Hospice of Michigan and all of our patients and families who we serve. We're serving close to 1,300 patients and families across 56 counties. And if you think about that, every one of those patients has at a minimum 3 family members. And those family members are not necessarily where they are. They can be all over the country. So this app is going to allow us to connect families together and make distance no longer an issue. In 2004, Hospice of Michigan felt that we had to really focus on a high-touch, high-tech organization to be able to connect people, to eliminate distance as a barrier, to improve efficiency and of our staff so that we could eliminate the hassle factors for our staff so that they could spend as much time as possible at the bedside. In healthcare, there's a lot of waste and rework. And so for us, a high-touch, high-tech environment has made a significant difference. So in 2004, we put laptops in the hands of our nurses so that they could order medications right at their patient's bedside. Even our hospice aides use PDAs to chart their care so that we can make it a simple checklist and to eliminate administrative waste and paperwork. And we've changed our pharmacy so that our medications are just in time. They're ordered at the bedside and they're delivered by FedEx overnight. That's true also with equipment that patients and supplies that patients and families need. So we're very proud to continue this tradition of really being a high-touch, high-tech organization. And as a matter of fact, one of our partners, Verizon, that you're going to hear a little bit more about later, calls us one of the most technologically savvy organizations they deal with here in Michigan. We're proud of this work because the more we can leverage technology, the more we can leverage touch, the more we can put people at the bedside and not be nursing and social working the system, but can actually provide those services to patients and families. None of this would be possible without the founding gift from Maggie Allesy, who's here today, who provided a gift to Hospice of Michigan for the Maggie Allesy Center for Innovation. Very rarely does a nonprofit organization have a center for innovation. But out of that Center for Innovation, what you are seeing is evidence of that innovation today in this mobile app that we're going to be announcing. The mobile app is going to be called HOM Cares, and it's a digital solution that will enable families and friends to create a private social network surrounding their loved one, a hub of expression, if you will. The new app will enhance patient comfort, care, and communication, giving our care team the opportunity to interact in real time with an extended network from across the country for family and friends. Whoever that patient identifies as family whoever that patient identifies as friends will be part of their network. The HOM Cares mobile app alerts family and friends when their patient has received a visit. They will be able to see a picture and read a short bio of the HOM team member that is making that visit. They'll understand the role of that team member, whether they're a medical physician, spiritual care, nursing, social work, volunteer, or another type of support. They'll also be able to see the date and the duration of the visit. So they'll know what kinds of visits, who's visiting, a little bit about that person, and how often those visits are occurring. They will become part of the care experience, even if they're in San Diego or if they're in Portland, Maine. The free app is available for download, and it's already on Google Play, and it will be on iTunes within the next 24 to 48 hours. It will be a simple app for installation for all of the current Android and iOS devices. So this is a very exciting thing. It's the first of its kind in the country, and you're going to learn more about that from some of our speakers. But first, I'd like to introduce my boss, Sandy Linden, who's the chairman of the Hospice of Michigan HOM Board of Trustees. Sandy.
Patty, thank you. I'd like to take this opportunity to really thank our dedicated board of trustees and our foundation board. This has been years in coming through Dottie's vision of this organization becoming high-tech, high-touch, and it certainly has become that type of organization. This work, including today's announcement of our mobile app, is what we call it's just a terrific marriage between our governance and our staff, and it just allows us to care for our patients and families just in a better way. Compuware, we're really so proud to be your partner. Thank you so much.
Hi, I'm Rhonda Davenport Johnson. I'm the chair of the Foundation Board, and I really want to thank, on behalf of the Foundation Board, a couple of individuals. First of all, I'd like to thank Bob Kennedy. Bob championed this when it wasn't popular yet a couple of years ago, and he really got behind it. So I really want to thank Bob for his leadership in this effort. I'd also like to thank his colleagues here at Compuware, because without them, obviously, we wouldn't be to this point as well. So thank you for all the colleagues of Compuware that attributed to this effort as well. Finally, we wouldn't be here today without Verizon and Verizon's support, and Verizon stepping up and saying we're going to make this become a reality. So I would like to bring up John McGowan from Verizon to come up and say a few words. John, thank you. Thank you so much.
Good morning. It's a pleasure to join you today. Chances are pretty good that if I scan the crowd, hopefully no one's on it right now, but most of you are carrying one of these, right? Smartphone. And let's face it, we rely on these mobile devices for almost every kind of communication available, whether that be emailing, talking, texting, tweeting, Facebooking, even video chatting now. And we also rely on these devices for getting the information to us that's most important to us, whether it's breaking news or sports scores, stock updates, maybe even the latest update on your eBay bid that you have going. Well, thanks to the innovation and vision of Hospice of Michigan, now friends and family members of hospice patients will be able to stay better connected to the care teams of their loved ones, no matter where they live. We were honored when hospice reached out to Verizon to support this idea that leverages wireless technology to connect patients and families. So we work very closely with the Verizon Foundation, which is our philanthropic arm, to secure a $24,500 grant so hospice could begin building this first of its kind app. And this innovative project that hospice has spearheaded really exemplifies how forward-thinking organizations these days can leverage wireless technologies to really make a significant impact and difference in people's lives. It's very gratifying for myself, for all of my colleagues at Verizon to have been a part of this initiative and know that our support is going to have a meaningful impact on people's lives during this very important time. And with that, and with more on the app itself, I'd like to introduce from Compuware, Michael Gerard. Michael?
Hello, everyone. Today, I'd just like to go through the app really quick with you. This is a demonstration of the iPad, or the iOS app built. We're going to demonstrate it on an iPad for you. First thing, as general with all medical type applications, there's a terms of use that you have to accept. Pop right into it, and then we pop into our main application. It's set up into two different modes, so to speak. So we have a logged out mode where you have basic information about Hospice of Michigan, as well as some information that you might get if you have a family member in hospice. So you can pop into resources. And in our discovery in building this application, we found out there's something that's really important that a lot of people tend to lose, and that's the clinical guide. So we provide a way to go out and get the clinical guide and give it to every family member really easily. So downloads as a PDF, and you have it saved locally on your device, and you get rapid access to all the information that they have available in there. And we also included a couple more PDFs about hospice in general and Hospice of Michigan specifically. We wanted to build to capture feedback as well. So right within the app, we provide a way to throw together an email and send it right off to the Hospice of Michigan team to let them know about how the app is and maybe how the care is going. So give that, that's built right in. And then there's also a donate function. We had to go out to the app, outside to the website in order to do that because of particular rules surrounding iOS, but built right in. So I'd like to go into the logged in state really quick. And I'm going to demonstrate for you the information that we provide to the users of the application when they have a family member in hospice. So right off the bat, you're going to see that the home screen rearranged itself. We added a couple new functions. One of them, very important, your loved one. So we provide a list of all the different visits that might have occurred by hospice or caregivers to your loved one. So we give you a list that's got pictures of the caregiver, date, as well as the time that the visit started. So I'm just going to show one right now. This is a photo of me for demonstration purposes. We click on that. We got a little bio about the caregiver, as well as the name and their role, and we color code the role as well. So you'll notice that that color code actually is also on the side of the table cells as well. And this scrolls down just as you might expect for something that there could be potentially many of these, tens of them, dozens, hundreds, possibly. And then there's one last thing. If you're noted as the primary caregiver for a particular patient, we give you a way to share access to this information to other family members and other important loved ones. So that's quickly, you're able to just put in a name, and an email. Oops, a little typo here. And then immediately they pop into the system, and then we'll send them a welcome email saying, hey, you've been added to the system at Hospice of Michigan. Here's a username, here's a password for you. You can download the application from your respective store, whether it be the Play Store or the iOS store, and then you can log in. And that's it.
Thanks, Michael. Nice job. I also do want to take a moment and recognize my team that developed this application. We couldn't do the fine work that we do without the extreme talent of the folks that build and manage these initiatives. So I'd like them to stand up and sort of take a bow for their efforts. So as I said earlier, we're very excited about this application as it sets the foundation for what we think could be a really wonderful sort of next generation of interaction between Hospice of Michigan patients and their family members. And as we look forward, we see a really wonderful future for this application and extending it into new areas and delivering new forms of connection. So with that, we're able to take some questions, feedback.
Again, just a reminder that Bob and his wonderful team donated, the Compuware made an in-kind donation for all the design work that you see here today. So thank you again, Bob, Compuware team, and Compuware.
Our pleasure. Questions?
I think it's a great idea. I think you're going to be overwhelmed. As these social networks go, I think it's just going to begin to kind of somersault. So congratulations. It's a great idea, and we're proud of you.
Thank you very much.
Thank you.
Yeah, we're excited about that, just to key off of that a little bit. We're excited about that because I think it does a number of things. Certainly it creates an awareness with new demographics and their ability to connect in with the great mission of Hospice of Michigan. And then also drive a deeper connection, a personal connection between themselves and Hospice of Michigan as well. It didn't necessarily exist before.
I personally want to thank you. I have my mother's under hospice care, and I have a son who's in Virginia, and I think this would be great for him to know just exactly what's going on. And again, I think this is just a terrific app. And thank you so much, and thank you Verizon, and thank you Hospice.
I'm sorry. When will this be in the iPhones?
So it's
24 to 48 hours, right?
It's available in the Android the Google Play Store now.
Okay.
And it'll be available for iPhones in a couple days.
Okay. Thank you.
We know that privacy of health information is very important to a lot of our patients and families, and also an obligation of ours as a healthcare provider. Can someone say a little bit more about the safety and security and confidentiality of this?
I'm going to hand that right back to the gentleman behind you, as Dave Truxell is the technology architect who designed the infrastructure and how this works.
Sure. So a couple of things. You may have noticed it's not, first of all, there's no personally identifiable information coming back in terms of the patient. That there's nothing being persisted on the device. When the app is closed, there's nothing stored on the device. So if you were to lose your phone and someone else got it, they can't get into the app and find out information that's there. The only information that we're bringing back about the visits is essentially the broad category of what that visit was about. We're not bringing back specific information about what happened during that visit and maybe what the results were of something that's there. We're also been very careful to take out certain kinds of data that might be disturbing to folks. For instance, if someone were to pass, we are making sure that the app does not inform the family that has occurred. So we've definitely taken steps to ensure people's privacy and help them have, the right kind of experience in dealing with the information that they're getting.
Yes, sir.
I was just wondering, so Does the staff that at the patient bedside have the proper equipment? Do they all have like your, Android or iOS devices to
That's a great question. The answer is, the question was, do the staff have Androids or iOS devices in order to put the inputs? The answer is yes, but that's not how the inputs happen. We already have an electronic medical record. So every time a visit is recorded in the electronic medical record and the staff member, that triggers the visit to whoever's part of that patient network. So the staff themselves don't have to initiate anything. They are just doing their normal visits, and they are documenting in the electronic medical record that they have visited and who they are. And so that is the link between our electronic medical record and this app.
It's important because it keeps a single source of truth as far as interactions are concerned, so you don't have multiple sources of that, and things start to separate and disparate.
But there's no way back into the EMR for this.
There's no way back into the EMR. This is a one-way message.
BlackBerry has a new generation of phones coming out in March and April. Would this be available on those phones?
No, not initially. No, we haven't explored the option of creating a BlackBerry right now.
Can you talk a little bit about the plan for notifying the family members about the availability of this? Have you already done that, or is that just coming out today? And tell us how that looks.
Yes, that's a great question. And Marcy or Mike, do you want to talk about the plan for notifying folks?
It's pretty much been under wraps until this point. We wanted to be able to make this announcement. Our staff is fully aware of it, though, so through the media we will be, obviously our communities will know about this, but then now our staff will be able to share that with patient families when they do sign-on visits with patient families or existing families that are on our program.
So there'll be a communication blast to all of our staff today. They know that something's been coming because they've had to write bios and get personal pictures, so that those are all loaded on the app. But we'll go live today, and there'll be an announcement to our staff and a process that they can share how to get onto the app with current patients, and then it'll be part of the admission process for every new patient that is signed onto the program. That will be in the admission process for the admission nurse to share the mobile app option for patients. What we will have to get, though, is a sign-off from the patient about who's in their network and who's the primary caregiver. The primary caregiver will be the gatekeeper of who will be in the network or not. Well, again, thank you, Bob. Thank you, Compuware team. Thank you, Compuware. Thank you, Verizon, for having the vision and the foresight to help Hospice of Michigan be groundbreaking in doing something great for patients and families and eliminating distance in this very important time of life. We appreciate it.